Good afternoon, everyone, and thank you so much for joining us today. Welcome to today's National Neonatal POCUS Collaborative webinar. Our title for today is POCUS and Gamification Beyond the Fun and Games. I'm Amalia Lee, and I'm going to be your moderator today. Before we get started, just wanted to go over some general housekeeping items to make note of. First, the chat is disabled for the audience, but the moderators may send out some general announcements via this chat for you to pay attention to. And also, please make sure we're using the Q&A feature in order to post questions. At the end of the talk, there will be a Q&A panel discussion after the featured presentation. Additionally, this webinar is being recorded and will be uploaded to the collaborative website, which can be found at neopocuscollab.com. Now, on to the main talk. It's truly my pleasure to be able to introduce our guest speaker today, Dr. Stephanie Leung. Dr. Leung, she's an associate professor of pediatrics at Baylor College of Medicine and a pediatric emergency medicine attending at Texas Children's Hospital. She's the director of the POCUS program in the Division of Pediatric Emergency Medicine and has a true passion for teaching POCUS and collaborating with educators. She additionally is the co-founder of the Petty Sono Fest, which is a team-based gamification competition for pediatric subspecialist fellows that has actually been held annually at the AAP National Conference and Exhibition for over the past 10 years. And so without further ado, I'll pass it on to Dr. Leung to take it away and teach us.
Awesome. Thank you so much for having me, and excited to join you all for this National Neo POCUS Collaborative. Give me a moment. I'm happy to share our presentation today. All right, so today we're going to start out with POCUS and gamification. I'm just adjusting a little bit of the settings here. So the idea is that we're talking about just games and just fun and really talking about how we can use POCUS in kind of your everyday teaching to really improve the learning and the knowledge of your learners. So today we're going to start with defining what is gamification in medical education and describe how it can be used to improve medical education and POCUS education. And the idea is that with the concepts we talk about today, that you can design and implement these strategies at your own home institution, wherever you have to be teaching at the time. So I have no financial disclosures. So we all are familiar with gamification in its many different forms. Gamification is somewhat relatively new to the medical education world. And there are a few studies out there kind of evaluating how is gamification used in medical education. And of a somewhat recent systematic review, it's basically talking about how you use game design elements as gamification and how to use that to improve academic outcomes. And we're going to talk about what those are. So the most importantly, the way that you can use gamification is you really want to focus on high yield topics, not the minutia, but really this big ideas that you want to get across to your learners. And the idea is when you're using gamification, that you're transitioning that knowledge into really change and skills and attitudes for your learner. And by using gamification, this method of doing so, we can improve the engagement, the motivation, and hopefully the knowledge retention of all of our learners. So there's many different platforms that exist out there. You probably are all aware of them. You can have digital apps. There can be smartphone games. There can be board games that you use. A lot of it can be even immersive role play. And then there's many even different various methods out there. You know, there are talks about is how do you get someone to commit to an answer, and they might be by visual diagnosis or maybe audience response. The other thing they may do is maybe team-based learning, or a lot of us are involved in simulation and can use that in gamification as well. So the one thing that we have to have a little caution about is it's really not just using games and then using it with some of the topics that you might have in medical education. You really have to be careful about using your gamification elements and aligning them with your curriculum objectives. That's the only way that you're able to foster effective and engagement in your learners. So out of all the things that they've studied for gamification in medical education, the number one thing they've been able to show across all the studies is really improved knowledge retention. And then beyond that, we have improved satisfaction, improved skills, higher engagement, but really across the outcomes, knowledge retention has been the one that's been shown to be the most effective. So there's many different themes out there on how to achieve that. Do we have our learners be in a more collaborative setting or in a more competitive mindset? And then when we think about collaborative, it's really that team-based approach. With that team-based approach, they really have shown improved outcomes with that knowledge that we're talking about, improving the skills, including engagement as well. And when we talk about having a competitive environment without collaboration, that really hasn't shown as many effective outcomes. Those have been a little bit smaller, limited sample sizes in the studies. But what they have shown is that with those studies, without that collaborative component there, that really the motivation isn't as strong and the engagement isn't as strong, and therefore your outcomes aren't as strong as well. How do you do this? Do you do this in a group-based environment, or do you have an individual complete these tasks and kind of in your gamification education? In these group-based scenarios, you can do team competitions, you can have collaborative problem solving, and you really with this, with that group-based competitions, you really are improving that satisfaction, improving that teamwork, which we're all needing in our like everyday lives with our medical education and in the hospital as well. And you're really improving those learning gains as well. You can still achieve some of these outcomes as an individual. And so they've been shown that really you can improve knowledge, but by doing so with doing personalized quizzes or maybe self-paced games, really once again in without that teamwork, with that collaboration, the motivation and engagement really isn't as effective. So maybe your outcomes aren't as long-lived as you may expect and hope to achieve as if you were doing like kind of group-based, team-based elements. So what are the game elements that we need to include for gamification? Number one, the most effective has been to be using narratives and immediate feedback and fun. So you're creating a story there. So it might be role playing. I mean, it's very easy to achieve in our everyday lives. As you say, the learner is now assuming the role as the attending, as the faculty member, or you're doing scenarios of different like patient scenarios that you might see within the NICU or within the EC in the emergency center in the emergency department. So that's pretty easy to achieve when you're doing the narrative. And you need immediate feedback. We know that in general, the most the feedback that you can give is really just in time. So as that scenario is happening, you can give immediate feedback to your learner. And the why gamification works and why we like it so much is because along the way, when you're doing all this learning, it's fun. This is our way for us to engage our learners. And really an important thing that you have to learn about is scaffolded learning. So as you start out, the very low level learning is maybe recall of facts or review of some basic elements that you might have for POCUS or medical education. And then from there, then you're challenging them with increasing complexity. And with those increasing complexities, you're basically improving that knowledge retention and making sure that they're getting some analysis on that way. And as we're doing that scaffolding, we're having a mastery of different levels of that knowledge. What's really helpful is a progress indicator. So sometimes that may be a dashboard, sometimes that may be, different prizes along the way or scores. And the player, or rather your learner, has to really feel that they're in control of their learning. You're helping to guide them as kind of like the game designer, the gamification, the presenter, and the one that's helping them along the way and showing them the game elements. But really, the learner has to feel like they're kind of in control of their destiny of how they're improving their knowledge. And really that social connection, even more so now in this environment, in this day to day, is that social connection is what we can help give to our learners to help enhance their learning. So along the way, what's been happening is skill development and application has been shown to be most effective is if we're using these scenarios and simulation-based games. And then the more hands-on activities, I think that's all a lot of why we all love POCUS. It's so hands-on and we can apply it to our learners and our patients at the bedside. The more that you can have these hands-on activities, which so goes hand in hand with POCUS, you're going to have that higher level of retention of knowledge. So education alone is not effective and gamification is not effective if you don't have a framework. And so we'll talk about this a little bit more and how it's applied. But really, hopefully you guys are familiar with Looms and one of the educational scholars back then that really created this educational framework. So Bloom's taxonomy kind of talks about different levels of learning. So we create this cognitive framework, and by going through the different levels from the base up to the top, we learn these materials systematically, and then by repeating them, we can apply them to have increasing complexity and in retaining our knowledge. And so you can see in the middle of the screen, Bloom's is kind of the classic old school original framework that we have. And then over the years, different scholars between Anderson and Krathwohl have improved upon it and kind of adjusted it to have increased learning and understanding of these concepts. So for us, let's talk about how do we apply this into the POCUS world. So hopefully you all are aware of Sono Games. It's quite famous amongst the ER world, the EM world, emergency medicine. But essentially, if you're not aware, Sono Games is a huge event that happens with SAEM and AUS. Basically, Sono Games is a competition that happens amongst the adult emergency medicine residency programs. And you can see with all these outrageous costumes here that different residency teams will choose a theme for their own team and also a costume. They will have their own unique name, and they will basically at home rehearse, practice, and challenge themselves, and then take their skills to a national competition. And it is a big bragging right amongst the residency programs, especially as they are recruiting. It is a way to recruit learners to your own program. It is a way to highlight your own program to your own division leaders and department leaders and to the hospital, and just to get your name out there. And so you can see there are different stations that happen, and there's our prizes for like best team name and best team costume and overall who wins the overall competition as they have different stations throughout. So with Sono Games, it's not just all fun and games. There actually is learning of educational content there. So when they did a study by Leteplo and all of his colleagues, they showed that with Sono Games, they surveyed the participants and the program directors afterwards and said, how effective was this event? And 94% of the participants said they agreed this was definitely an effective educational experience. And the nice part with this high number of respondents, they were able to show that ultrasound knowledge they felt was improved, and definitely with enthusiasm overall for POCUS. And they thought they could translate these skills into POCUS and into clinical use. And what was really cool to see is also they were able to take these concepts and bring it back home and hopefully create like a mini Sono Games or some of those ideas to help with the learning back at home. So with us in the pediatric world for POCUS, we are still, I don't know if you would still call us in our infancy, but we're still in our young stage right now. And so myself, and then also my co-fellow, my co-POCUS fellow, Mono Shah, we have seen the enthusiasm of Sono Games. We're like, how do we translate that enthusiasm into the pediatrics world? And so we thought about bringing this to AAP. And of course, like whenever you have an idea, you're not able to like launch it immediately. So luckily hopefully you guys think the same, is that within pediatrics, the emergency medicine world, and generally in medical education world in general, we are very supportive of each other. So Mona and I went to Risa Lewis, who's one of the originals, the OGs of like point of care ultrasound in the adult world. And we said, we have an idea to bring this to the pediatrics. Is there a way that we can get incorporated into Sono Games and kind of figure out and see what you guys do and hopefully bring it back to peds? And they said, of course. So Risa Lewis and her colleagues were very supportive of us, invited us over to Sono Games where we could help proctor, basically get the behind the scenes look to see how did they do all the logistical work and create the stations and set them up. And then we brought it back to AAP and talked to our leaders. So our pediatric leaders within AAP and within pediatric POCUS in general are very gracious. So initially we talked to Dave Kessler, Alyssa Abo, and then they said, yes, we should definitely bring this to AAP in the peds world. But of course, when you have an idea, you have to do proof of concept. So the first time we did it, pediatrics at AAP does a POCUS workshop. So they said, let's run a mini event. So we ran it at the POCUS workshop and did like a mini Sono Fest one year, and basically based it upon the concepts that they wanted to, reinforce at that POCUS workshop. And then it was a big hit. They saw a lot of enthusiasm and saw a lot of knowledge retention for their learners. And they said, yes, we agree. And so then we went on to the agenda for the next year for AAP for the SOEM, Society of Emergency Medicine, and then went on from there and have been hosting for roughly about 10 years now with the SOM programming, and now have expanded beyond just the pediatric emergency medicine fellows and really have said broadly pediatric subspecialty fellows. The hope is that we have, PHM and NEO and PICU and PEM and everybody who's all enthusiastic of fellows to join as subspecialty teams into our competition. So what is PD Sauna Fest? PD Sauna Fest is a pediatric point of care ultrasound competition. So we've modified what Sonogames does into the pediatric world. And the idea is we have a team of 2 PD subspecialty fellows per team. And the idea is they also have an outrageous costume, an outrageous name. And then we have different stations out throughout our space with AAP to basically challenge them and to see what is their pediatric knowledge for POCUS and how can we improve upon them. And so they are learning at the same time, demonstrating their skills, but hopefully learning and building upon those skills and bringing it back home for their daily clinical use, and then also to help learners back at home at their home institution. So we also have, the SaunaFest winners overall, and also awards for the best team name and best costume. And you can hear different. I'm throwing you different pictures out here so you can see kind of the different costumes we had throughout the years. Our home institution at Baylor, we had a version of Doc McStuffins, and then you can see we always kind of try to use the theme of the AAP host city. So one year was in New Orleans, we kind of did like a Mardi Gras theme. This year we were in Denver, so we did a kind of like athletics type, sports type theme. And this year they were super creative. So in the middle we have the Fastronauts from Baylor. I will say we have like Boston was representing with the Dunklin Dopplers. We also had the Acoustic Shadows, and then the best name went out to the bottom right that you could see, Leung sliding into your DMs. I mean, that one just like took the cake, was the runaway for the winner this year for the name. And you can see that we incorporate different kind of game elements as well. Sometimes we don't make it as easy for our participants, and you can see right there we're having some kaleidoscope goggles so that we're kind of blurring their vision a little bit, so they really have to know where's the placement of the probe onto that patient and our simulated patient, and their partner are able to kind of like guide them to get the best images. So let's revisit kind of Bloom's taxonomy and kind of go through this and see how maybe you might be able to apply this at your own institution and how we're doing it with PD SaunaFest. So at the very base of Bloom's taxonomy, we're talking about we want our learners to remember. They want to, at the very basic thing, they're recalling some facts and basic concepts of POCUS that we want them to remember. So we're very familiar with this kind of like audience response, might be poll everywhere, Microsoft Forms. You can do it in the very basic way possible, sometimes just raising your hand and kind of a little score sheet or a different audience response. But this is very easy kind of like facts, basic kind of skills that you want them to know, basic knowledge about POCUS. And then we're going to step it up a notch. We're going to make sure that our learners understand what's going on. So by doing this, we want them to be able to explain ideas and concepts. So if we're looking off to the side, we can see a version of Monopoly, but basically we created a foreign body phantom that had all the different pieces of the Monopoly pieces in there. And so we wanted them to be able to describe and identify, what those artifacts for metal artifacts are in a phantom, and be able to differentiate, maybe what a race card looks like, differentiate between a hat that has like a more linear appearance. And that's a way for them to be able to locate and show that they're able to recognize what different artifacts look like within the phantom. We want our learners to be able to apply these concepts as well and be able to use it in new situations. So definitely this is a time when case-based scenarios are very applicable. So really, so you can see in station 5, we're talking about a patient who we recognize is really concerned for DKA. And so with this, we want them to be able to, problem solve, to demonstrate they know the concepts of like, what does it mean to fluid resuscitate and hydrate a DKA patient and take care of them appropriately. So we want them to be able to, how do you do that with POCUS? How do you identify and do vascular access with POCUS? So you can see we march them through stepwise to say, how do you look for vein versus artery and differentiate between the two to be able to interpret what is a vein, and then be able to show us how you're able to catheterize that vein. And then also at the top, you can kind of see we did a version of Pictionary. So sometimes you may be able to do your little bit of like art skills in there. So we would maybe have a case-based scenario to talk about where you're having abdominal pain, and maybe you have to identify stones, and what thing would you be able to draw that maybe would allude you to the gallbladder, and be able to, one partner would be able to draw out that gallbladder, and then you'd have another, their partner be able to interpret that drawing and then be able to go and scan and show that they're able to scan that body part within our simulated patient. You want them to be able to show that they are able to analyze and basically draw connections between your different ideas about POCUS. So really differentiate. So when we're talking about different artifacts that may be just a concept to them, but that you're able to show that it exists within the body, and what's the difference between mirror image versus edge artifact versus posterior acoustic enhancement, or when you're just talking about the heart itself, what is the difference between the different views and why you may be able to attain those different views depending on the patient care scenario. And we want the patient to really be able to evaluate and really justify their clinical decision making. So we are all aware of that Monday night chaos that happens in the emergency department. So typically Monday night is when it happens, where you have all sorts of patients come through. And so this is an example where they might come in for abdominal pain and very undifferentiated, very vague complaints. Abdominal pain, dehydration, chest pain, tachycardia. And so then you would have the learner be able to justify like what POCUS exam and scan they want to do, and then be able to demonstrate to you on the simulated patient that they are able to complete that exam. And the idea is at the very end is that hopefully you're bringing it back home. You're able to take these concepts and design something at your home institution, and to be able to show that you have mastery of these concepts of POCUS. My home is at Baylor College of Medicine, Texas Children's Hospital, but the idea is that hopefully you are able to bring these concepts, and your learners are able to bring these concepts with them, and be able to use them and apply them clinically as well, or be able to teach other learners. So hopefully through today, you guys can see that gamification is not just fun and games, that the idea is that really by using gamification in this fun environment, using game design elements, that you're able to diversify your teaching strategies. And with that, we're really improving knowledge, your satisfaction of your learners, their skills, and that engagement. And then thinking back through that Bloom's taxonomy, how we're building that educational framework, and step by step, we're increasing the complexity of that learning. But really, as you're doing that, that you're really honing in and really allowing them to have that increase in that knowledge. So this is kind of a brief intro of gamification, and we're going to have this expert panel discussion later on. I am happy to field any questions. You can shoot me an email, and then also do me a quick favor if you can, and also do a quick little QR code as well. This will help with a little valuation so I can help teaching other learners as well. Thanks.
Thank you so much for such a wonderful, engaging talk and really incorporating such amazing pictures from the PD Sono Fest. That was great to see. We will now transition to our Q&A expert panel discussion. So please make sure you put any questions into that Q&A platform, and I will be able to relay them to the panelists. Joining Dr. Leung today, we have Doctors Chen, Kusalas, and Paulin. Dr. May Chen is a neonatologist at Johns Hopkins Children's Center in Baltimore, Maryland, and she also leads their neonatal POCUS program. She's an active member in the Neonatal POCUS Collaborative and has taught at the AAP National Conference POCUS workshops. She also has helped with the PD SonoFest for the past 2 years and has an interest in increasing gamification in neonatal POCUS. Dr. Matthew Kasulas recently joined the Division of Emergency Medicine at Yale School of Medicine after spending 8 years as a faculty member at Cohen Children's Medical Center, where he was the Associate Program Fellowship Program Director and the Program Director for the Emergency Ultrasound Fellowship. He obtained his master's degree in health professions education and has been the co-chair of PD Sonofest for several years. And lastly, we have Dr. Danny Paulin, who is a pediatric emergency medicine physician and the director of pediatric emergency and critical care ultrasound at Akron Children's Hospital. She leads initiatives in procedural simulation training, global health, and quality improvement, and is passionate about advancing education and collaboration across multidisciplinary teams through innovative methods like gamification. So thank you so much for our panelists for being here and dedicating time to this webinar. I would like to start the Q&A session by asking our panelists the following question. For programs that are just beginning to incorporate gamification, what are some core resources or tools that you consider essential to start effectively? Additionally, are there any online frameworks or platforms that you would recommend teams designing their first gamified POCUS session?
I could start. I think imagination is honestly the only resource you need. Most of what you do with gamification doesn't need anything particularly fancy. You can get really fancy. It can get really elaborate. It can get really big and multi-layered. But if you're just starting, just incorporating a game that's simple that can be done on a blackboard is all you need. You really don't need too much to start. Once you get used to the idea of incorporating games into your teaching, you can start adding on those more bells and whistles, is it would be my answer to that.
I totally second that. I mean, Maddie and I have been doing this for several years now. Like the more that we do, the more you realize that like the more complex it is, the more things can go haywire. And to be honest, that like Maddie and I do this, and we're going to a city. Sometimes we've never been to that city beforehand. We're arriving, and then you have to put on this event for 2 hours with like a day's notice. Like and then to like set up a whole room and multiple booths and multiple proctors, and then you have your simulated patients. There's a lot of moving parts, and if you're putting in tech and all this stuff, it really gets too much, and really the learners don't need it. Like unless you're trying to create like some platform that they can track like over a years or something like that, like fellowship or something, like for a event at a time, you really don't need that complexity, and it's just more things that can happen that can go haywire, and it's more expensive. So especially if you're starting out, I agree totally. It's like imagination that you don't need much more beyond that.
Yeah. I'll chime in just from a Nino side too, and one who's a little bit more early into the gamification realm, right? Is that I use a lot of resources from the PIM world and from the adult EM world. Because Sono Games and PD Sono Fest have been ongoing for so long, I take a lot of inspiration and a lot of collaboration from Steph and from Matt, and Danny as well, in terms of a lot of the stimulation that you've done. And so I think a lot of the resources that are there are our collaborators, are our colleagues, our PEM and adult EM POCUS colleagues. There's resources online like SAEM and AEUS have also some gamification like ideas too that I've used that have been really helpful too.
I think also like seeing it in person if you can. We do realize there's limited resource, and sometimes you can't always travel, but there's nothing like being immersed in it. Like being at Sonic Games is an experience. And we would very much encourage all of you to do it if you're interested in gamification. It's like being amongst all that chaos, but at the same time, everybody is enthusiastic about POCUS. And then that will spark your creativity to be like, oh yeah, I'll take this idea, spin it a little bit at home, or like that is way complicated for like these 5 steps, but maybe I can take step 1 and step 2 and implement it at home.
Yeah, I like to do a game day in my last lecture day. And I usually try and incorporate the things that you do at SonoFest. But for someone who's just starting out, I think just finding a way just to create competition in a simple way, like using Jeopardy templates, or I think I have a cash cab template for questioning and things like that. So it's not just like reading questions and stuff. I like to use board games a lot, not just for their pieces, but one of my favorites is the Tiny Hands game. And so they have to either scan with the tiny hands or do a thing with tiny hands and then and then do a task. And then the other things that I like to just create competition is just knowing that people like to be the best. And so to encourage people to scan outside of like your lectures and things like that, I like to post at the every month, like how many numbers people have of scans. And so it either recognize like, oh, wow, I'm kind of behind, or yeah, look at that, I have as many as the third years do. And then I have a little bag of rewards that I give to the monthly winners.
We have at our institution, we have an award called the Smooth Operator. So basically, over the course of a year, whoever, it could be attending or fellow, has typically been a fellow, but who does the most, credential worthy exams. And then we have a trophy. So it's like a trophy that we've mocked up of like a probe and like the gel bottle and stuff. And it's really gaudy. So if you win, every year you get to add something new to it. So it is just kind of gets grander and grander, but you get, you get to take the trophy for the year, and then you get to be part of like PD Sonofest the next year as part of the team. And bragging rights at graduation.
Very important to have bragging rights at
Yeah.
graduation. Yeah, and I think Dr. Paulin kind of began asking kind of the next question, but if the other panelists wanted to elaborate on specific examples of different Neo games that could be incorporated at People's Institute, just to begin getting different ideas for them to bring, we would love to hear.
Yeah, there's one that we also are implementing too, is like kind of like POCUS bingo. So this came out of like when you're in the trenches and it's like respiratory season, there are all different viruses spitting around. It's just like, what pathology do you see at the time? And somebody wins a prize for that. So we're implementing like POCUS bingo. So you're trying to keep motivation throughout the year. So then keeping almost like a scorecard of it, and then whoever gets a prize will get a trophy at the end of the year too, and probably like a little prize or something like a gift certificate or so. But just keeping them engaged and trying to get them to get different pathologies that you might be finding within your specific field.
I like
I
also, oh, go ahead.
No, Danny, go ahead.
I was just gonna say, like, just to keep attention, because sometimes your fellows are super tired at 9 in the morning. I like to print out coloring pages, anatomical ones, or sometimes like mandala livers or something like that, that are related to whatever I'm talking about that day. And so we do the tape review for like the first half hour, and then I give my lecture for the next half hour. So for that hour, I give them stuff to color. And I found in fellowship when I was a fellow that coloring, it's relaxing, but it also keeps your attention.
I think some of the other examples I've thought of and have kind of modified from PD Sonofest, for instance, one I really love, especially for the neo folks who, when we're using like vascular access and doing really small, minute like movements, is that the POCUS charms. So it's one of my favorites. I use it a lot for our vascular access. And when it was in PD Sonofest, I don't know, Matt and Steph, you guys remember, it was like 2 years ago, it was like Feed the Panda, right? So like these little, so there were these little metal panda charms that had a little hole on top, and you had to like thread the catheter through that hole. And so for some of my beginning learners, they didn't know how to do that yet. Like that's still a skill that they were learning. But the other thing that they had to learn is how to make these micro adjustments to even find the charms, to see them. And so even the first step, the beginner step, is just like, find the charm. Tell me what that charm is. And so over the years, we've changed it to in Halloween, where I put in little Halloween charms, so they have to find it. Recently, we had a keys to my heart. So there's like a couple of hearts and keys in the gelatin that they have to tell me like how many keys there were, how many hearts there were, and really pushing them to make those like micro adjustments, which is a skill that I want my fellows to have. So kind of aligning those two together. So that's a neo kind of game that we've done. And then the other one is just another one is just in terms of like, a lot of concepts for neonatology are very similar to PIM, right? We want to know lung sliding, we want to see pleural effusions. So we've done like POCUS Pictionary with our high fidelity simulator, and we've had them kind of show us like group-based competition against each other, and like, okay, which you pick a card and you got to show it on the mannequin what it is. That's it's neo, but also very relevant to all of POCUS piece.
For sure.
Those all sound amazing and such great ideas that we can bring back to our institutes and incorporate. Kind of branching from that question, one of the questions were thinking about small community hospitals with micro learning sessions. What gamification can be developed and easily implemented for these hospitals?
I liked at Sonofest, one of the competitions at the end, the tiebreaker kind of one, was just listing body part or finding body parts from A to Z. You don't need any, you don't need any resources whatsoever, but they have to, it makes them think and of what they can see with ultrasound. So
that one's definitely a favorite. And when she's talking about the final step or final stage of Sonic Fest is like we'll have multiple teams depending on the year, but then basically we almost do it in like a 3 stage as we're doing stations. After like round 1, we'll show the scores. Then round 2, maybe more stations or a little bit more head-to-head competition amongst that group, that middle group. And then at the end, we really do have only 2 teams that are top scores, and we do some sort of head-to-head competition. And so as we're doing this, this veers off a little bit on the community standpoint, but it's talking about like ABCD. But what we do is we show each POCUS team, and we show their images up on the big screen, and then in real time they're scanning. So as they're doing like, A is for, aorta, and they gotta like go scan it. And then, but each team can come up with whatever, body part they want to scan for that letter. But that kind of race really stimulates like the engagement amongst the learners. And also you want to not only get your learners enthused, but the people who aren't doing POCUS. You're trying to grab them along too. And so that you're showing that it's fun. They're like, I want to be a part of that. And we have gained a lot of learners that way too.
For the community setting, I know a lot of people know I do like some 3D printing and make some pretty elaborate phantoms, but I started with basic gelatin, Knox gelatin, and tofu. And so, like, if I'm teaching something and I don't have a particular model for it, then I'll just like real quick, I'll make something, even though I know it'll get moldy in a few days. But for that, there are resources online. It's oof, I can't remember. I think it's Alien. But it's a whole list of phantoms and some published articles. And most of them go into detail about how to make them. But if you want to do a quick learning session, like with vascular access, those models are using tofu and straws are like pretty straightforward.
The other thing, I think this is true for any situation, but probably more so for a community site. I think incorporating the game into your practice as opposed to it being a standalone event is probably going to be more universally useful to your whole department and division. For example, we had a ultrasound track within our fellowship. And what the track fellows ended up doing was having like almost a target that the first person to find this week is going to be, get something, or like, and they came up with these things themselves. Once it was initiated, they did it. So like, for example, one of the less common artifacts we find is something called Twinkle Artifact. And that's with renal stones. It's something you could see at the posterior part of the bladder. And I mentioned during a conference or a tape review that it is one of my favorite things, and I've never found it myself. And that sparked them saying, the first one of us who finds it is going to get your prize. And we're like, what? I was like, what prize? I didn't say there's going to be a prize. But that became like a thing. Like once someone found that, then someone said, you know what I would like to find? I want to find this thing that we heard at this conference from Nerve Blocks. And then it just became like a constant little mini competition. And what was cool about that was those who hadn't gone to that particular conference or that particular lecture then was like, then would get filled in, be like, wait, what is it that we're looking for? What is this thing that you're talking about? So it became a little bit of an education along the way that was sort of micro education, but also a little bit of fun. I think setting up something like that would be particularly useful in a community where you don't have like a necessarily an academic day or a didactic day where you can do a game-based session.
I think we shouldn't underestimate the competitive spirit of those of us in the medical field, right? And I think that is that's so much about gamification and game-based learning is a lot of that competitive spirit too, which I think is helpful because sometimes you have, the early POCUS adopters, they're going to do it. They're going to do POCUS even sometimes if there's no games, but like if you want to pull those along that aren't quite with you, that competitive spirit, I feel like helps so much in some of our teaching.
Definitely.
And that was a great segue as we talk about like the competitive nature, but also wanting to provide education to those involved with POCUS. How do you balance the fun and competitive elements of gamification with the need for developing those clinical skills and assessment?
So my fellows, they want lots of hands-on, but then when it comes down to it, then and I'm like, okay, let's do this. Then sometimes there's not a ton of like, all right, let's do it. Or like same with scanning on during their own shifts. I to the point where didn't they asked me to like take out tape review, and I was like, no, I can't. And it's no. And so I actually felt it was better when we did tape review like a second day. Instead, I just incorporated it, and we have a full 2.5 hour day once a week or once a month with them. But I do think that kind of keeping tabs on them and how much they're scanning or is helpful to just keep them responsible for what they should be doing.
Mhm. No, I think it's challenging. I will say, like, when we're doing gamification, to be upfront, it is a lot of work. It's like very easy, not very easy. I tell you that it's not easy to develop lectures, but it is more standard, for us that are educators, so we can crank out a lecture. But to add that gamification element, it takes a lot more effort and time. And so, like, and it's hard. You can't do the gamification with every single lecture either, because then they kind of like get burnt out on it as well. So I like how Danny's saying you need an over a longitudinal track record of them. However, you're going to do it by like number of scans or something similar to that, or a points-based system. And then in that longitudinal curriculum, you're sprinkling in times where you're doing the gamification, but not every single lecture. Like, you as the medical educator will not be able to sustain that unless you have a ton of help or a ton of time. But then also, then you have to keep those ideas fresh. So if the gamification every single time, probably is not the most effective, but like mixing in, different other methods, a little bit more traditional, or some other, educational methods that you're finding.
CoreUltrasound.com has a good program that if you do have a little bit of funding, I think it's $75 per student, where they have a Q bank. And I've gotten good feedback from our fellows on, because a lot of times when we just scan each other, like it's a bunch of normals. And I like the Q bank is nice because it's, the topic would be FAST exam. And so it'll show you a whole bunch of different kinds of images of FAST exams, and you have to choose if it's normal or abnormal, and then like where's the free fluid. And so it's so once a month I have them do one of the quizzes. I think it's like 30 examples they go through, and then that way they can see more abnormals and kind of get a broader range of normals and abnormals. I also like to do QI projects. And so, because my hospital is not super fond of prospective studies, but so I turn them into QI projects. And and we, so for example, marking the conus and the sacrum for lumbar punctures. And it's not just for their patients, but there's like reminders and things for people to say, hey, grab a fellow if you're doing an LP, which finally, like, meningitis is coming back. It took a hiatus, of course, when I did this project, but so yeah, the fellows, they learn it at boot camp, and then we kind of remind everybody. I have another lung ultrasound project, and there's like little POCUS Panda reminders, like on near the LP kits, and then also on the computers. And so that helps to, like, in practice, get people to ask fellows to do stuff.
Dr. Paulin, would you mind just repeating the name of that website just for all of our participants out there?
Yeah, that one is coreultrasound.com.
Which also, they offer a lot of free content like FOAMed, From the POCUS community, we are very big about sharing, and they are very generous with their educational content. So not only about like POCUS topics, so that is core ultrasound used to be 5-minute sono. So if you just needed to quickly know how to scan something, look on there for a brief kind of review. And there are also some tools on how to create better like educational content on there as well.
Great. Thank you for providing that resource to all of our participants here. Our next question is kind of focused on, Dr. Paulin mentioned it previously, but this relationship between gamification and its involvement a lot with simulation. And so what innovations and simulations have been helpful in your game-based teaching? For example, can you tell us more? You mentioned like your 3D printing and using that to help facilitate simulation and gamification.
Yeah, I don't get much funding for my or any funding for my program. So I and the phantoms are crazy expensive, and so it's I felt it was important to have these fellows do these procedures with decent models. And so I started out with just doing the gelatin, and like I said, it would get moldy, and I'd spend all this time doing this every year. And like the 3 days before my POCUS boot camp, I was just exhausted, and my kitchen was a mess. And so I started using ballistics gel, and I was using just big like Rubbermaid containers, and I ended up needing so much gel, and that was time consuming and expensive. And then so I was like, well, we scan a lot of babies, and this needs to be like pediatric size anyways. So I started doing like oh, what's it called? Plaster of Paris, and like dipping like babies into plaster of Paris so that I had like a baby mold. And that also was messy. But it was kind of still on the right track. And then it's kind of the evolution of everything. So I actually went on a date with a guy, and it was during COVID when like some people like bought little cheap 3D printers, and he had one or two, and he printed those like mask things that like hold your mask on. And that's what sparked my idea, like, oh, I could 3D print molds and like and ribs, because otherwise like every Halloween I would hit up Joann's, which sadly is gone now, and like get their like clearance ribs and stuff like that. So I have all these bones in my basement because I used all the ribs, but so it's the 3D printing, I had something I had never done before, and the printers actually aren't that expensive. There's a little bit of a learning curve, and then the main one is like trying to find the right material. But there are some there's free software out there to get mold or what's it called? Example, like of just like a body or a hand or something like that. And then also Tinkercad is a CAD software that lets you like change the size and add like holes and things. And so that way you can, or I create molds that I pour the ballistics gel into. And then I have a kind of special recipe that I use to create sonographic reflections and artifacts. So it has like an appropriate sonographic experience. So in this way, like these mannequins, some of them I can use year and year after again without having to spend 3 days before every boot camp doing this stuff. However, I do get really picky. Like my LP model is money. That one's like I never have to redo that one. It's always really good, and probably the most realistic. And then the other ones though, like I'm always trying to get a better heart or pericardiocentesis model. I do have a 4-chamber pericardiocentesis model that's pretty good now. I'm almost satisfied with it, but every year I try and do something a little bit better with one of the mannequins. So I do still spend some time. I finally perfected the vascular access mannequin where there's no air bubbles. So happy with that one.
Wow, you should open an Etsy page for all of us to
I
purchase
know.
these amazing models and incorporate it into our own practices. That's amazing. Would love to hear from each of the panelists for our next question. What advice would you give to a neonatologist or provider who wants to advocate for gamified POCUS training at their institute, but is facing resistance from leadership or colleagues?
I think it's a great question. The more that you can show examples, the better you're going to have success for. So if hopefully leadership is involved somewhat at AAP or PAS or some of the other conferences, and then be able to show them examples of it. The other thing at gamification is that we talk about, it increases your presence of your program. So if maybe baby steps is if you find a competition and can enroll your own team, and maybe 1 year you start by just having your fellows, your learners, or maybe the attendings go, and then you show kind of demonstration that what it's like, what is this event, what is even gamification with POCUS, and then you can bring it back to your home institution. But by showing that you can get the name out there for your own institution, that works wonders, because we do say, like, even for my own home institution, not only having reps from our fellows and they're learning, but at the same time, it is recruitment. You are showing that like your program is a strong program that offers POCUS. Like, so now for PEM, as our PEM fellows are coming through, as our PEM faculty applicants are coming through, we're able to say that we do have a very strong presence for POCUS at the local, regional, national, international level. And here it is, and we were representing. And then you meet people along the way and you're like, oh, I saw you guys at SuttleFest. And then now I'm interested in your program, and I can tell that directly to my leaders.
I think also keeping in mind that what the learners are now coming in, this next generation, is very different from the generation of which, yes, our potentially like your higher leadership is. But really, if we want to recruit this next generation of fellows and applicants, one, they want POCUS, and two, they want to know that it's like something fun and engaging and that they're gonna, enjoy doing. And so I think I guess millennials, Gen Zs, Gen Alphas, right? We treat technology very differently, and we treat the way we consume education very differently from the older generations. I guess I'll say it that way. I'm sorry if I offend anyone. But it's just, we have different learning strategies. And so that's how I would kind of say it to our leadership, right? We've got to be able to target different learning strategies to different learners and different generations.
I think if you get your simulation department or whoever your sim director is involved, that's a department that's usually already well established, and either they can help you fund some of it, and also if they actually ask you like, what funding do you need for your program, to already just include that in your budget, and not under gamification maybe, but under simulation. And if they ask like, why are we getting little star ornaments or whatever, and why did you spend so much at Joann's? No. And then you like to get reimbursed, but you can then say like, well, a lumbar puncture phantom costs $10,000 and I made this for 50. And they're like, oh, wow, good job. Okay, keep going. So
I would say there are two things that I would say. First is just do it. Like I think the best way to prove the point for gamification, or to make the case for gamification, is to demonstrate success. So I would just incorporate it into the stuff I'm already doing and let people see how it works. And again, I would start small. I don't think that when you are starting, it has to be an elaborate game. It can just be something simple like incorporating a timed element before someone does something. And then that's the first step of a procedure. And then the next person who does this other competition gets to do the second step of the procedure. Just incorporating little things into your teaching that helps increase the learner's engagement, I think, is your first step. once you have that and it's become established as a successful learning modality, then you can start building up and asking for resources, and then say, hey, well, you've seen that it works. All I'm asking is for $50 to make this model that would otherwise cost $10,000. And then once you've done that, you can then start asking for prizes and, like start small, work your way up. And when you're as small, don't even involve them. Just do it. Just do it in your own teaching. And then I would 100% second everybody's voice about getting involved in national gamification competitions. When we first started getting our institution involved at where I was previously, I actually had people who are great educators who I really think support gamification and support novel ways of doing things, saying, well, are we really going to pay for them to just go play games? Like that was their response to me wanting to get people funded to go to my bias, but SonoFest. And then by the last year I was there, people were like, wow, we've won 5 years in a row. Like we need to keep this going. Like we have to defend our title. The same people, the same people, who initially were skeptical. Once you've shown proof of product, are very much engaged and very much excited about it. And we had a name, like for sure. There were people who got upset that we won a fifth year in a row and thought it was rigged, and we're talking about it at other conferences. So I think just starting small, working big, and then showing success are the two things that are going to make the case for your leadership if you're getting any type of resistance.
And then also as you're doing these things, a lot of times it's our learners who are like the fellows, the residents, the med students, but then if with your leadership, incorporating faculty. So faculty means leadership, having them part of the competition as much as possible as you're doing it,
Yeah.
making it, advertising it and promoting it so that you're getting eyes on what you're doing.
Thank you all so much for sharing. This has been such a wonderful and engaging discussion, but we are unfortunately out of time and we want to be respectful of the time of our panelists and our speakers. So thank you so much to our speaker and panelists for sharing their expertise and dedicating their time. And thank you all so much for joining for this amazing webinar. Please make sure you join us next month for our November webinar where we will have Dr. Sarah Kolnick, who is going to talk to us about neonatal cranial ultrasound. Registration will soon be available through our website, and we will also send things out through our listserv. In order to receive those emails, please make sure you sign up on our website. Additionally, in the chat, you will see a link to the Neo POCUS Collab website where you can find recordings for all of our webinars, including the one today. So thank you so much, everyone, again for joining us, and we look forward to seeing you next month.